ahead and get started. Hello, all my little initial tiles. Thank you for turning on your camera. If you've turned on your camera, I will tell you that um, I don't see, I just see a very few of you. So you're welcome to use your camera or not use your camera. I do like to see your face and know who I'm talking to, but it's okay. I understand. I don't like to do the recording. Be on a recording, and this is recorded. So if you have any issues with that. So let's go ahead and jump in there and get started. I'm Peggy Sarcomo. Hi to anyone I haven't met yet. Welcome to Smoke-Free Multi-Unit Housing. I am the Technical Assistance Advisor for STEP program, State Tobacco Education Prevention Partnership. I work at Denver Department of Public Health, which is the city health department down in Denver. But I also do the TA grant. This is my main function. So I work across Colorado and with all you grantees. And if I haven't met you yet, again, hi. So let's go ahead and get started. Today is session 1 of a 3-part series. You can attend single sessions, but it's recommended that you attend all 3. We're doing these in a level of progression. So we're looking at session 1 as kind of a response presentation. And then the second one, session 2, is going to be more of a progression. And then we're going to move into like prevention. So it's 3 levels, beginners, novice, and experts. So please join us for those upcoming trainings if you haven't registered yet. So let me see here. Okay, so today our presentation is Building Healthier Communities, which is the fundamentals of smoke-free housing. This is session 1, and we're going to start off with just letting you know why are we here today. The reason I like to give the why really early is because, I've been with this program as TA for about 7 years now. And my first year, I sent out, after complaints went out, I sent out a questionnaire to one of the tobacco managers. And I said, did you respond to this complaint? Can you catch me up what happened? And they said, what do you want me to do about it? And I thought, oh, okay. So I realized, wow. Because there's no law, it does feel like there's nothing we can do about this, but I'm hoping to show you some pathways today where we can support folks even without a larger policy, and maybe even advance to a policy. So why are we here today? So we understand that home should be a safe place. It should be a place where the air we breathe puts it at actual health risk. Secondhand smoke continues to threaten the health of our communities, especially the most vulnerable people. Together, we have the power to change that without policy. So why is this important? My mom asked me that today. And my mom asked me that once. What do you do? And I told her, she said, does that still need to be done? And I'm like, yes. Why is it important? So the current trends, as you know, even if you're in a small rural area, the land is sacred and it's getting very, there's not a lot of single family homes being built. There's more high rises. So our housing is tending to turn into multifamily housing, which is shared housing to preserve property. And so we are looking at increased shared housing, where Denver has about a 55% of shared housing, which is more than half of their people actually share a wall with another individual. So we also have experienced incredible marijuana use. Marijuana rates right now are at about 26%. And we've gotten smoking rates down to 14%. But as we tap down smoking, marijuana increases. So we have more people using marijuana indoors. And marijuana secondhand smoke is as dangerous as tobacco secondhand smoke. So despite smoke-free policies, exposure to secondhand smoke still continues. And that's kind of that's apparent by the amount of complaints that we get through our state complaint system. And we do know that children and seniors are at most risk. So we have a lot of seniors with breathing disabilities, children with very small lungs, and we'll go into that. They are very much at higher risk than other individuals. So today we're going to have a short introduction. We're going to talk about the problem and the response real lightly. We're going to go more into that in the second session, but we're going to introduce it today. So we're going to introduce the understanding of the health effects. We'll talk about the solution, which is policy, And then we're going to go over or open up how to respond to complaints. And again, this will go deeper in session 2 and session 3. So we'll introduce concepts, we'll practice them, and then we'll see how we do. So now we're going to have some introductions because there are there's 24 of you. Hi, 24. Because there's 24 folks to do. We only have a very short time here. We're going to do breakout rooms for introductions to give you an opportunity to get to know your neighbors, because we work remotely a lot and we're all across Colorado. We do want for you guys to get to know each other for peer mentorship and just for the understanding of what are you guys doing in your county. So we're going to meet your neighbor. I'm sorry, I didn't introduce Bianca and Angie. Bianca and Angie, hi, wait. They work at DDPH with me, and Bianca, your hand raised, hi. And she's going to be our engineer today, so she's going to be handling our breakout rooms and monitoring the chat box. And we also have Pete Bialik here today. He's the founder of GAS, great group to alleviate smoking pollution in Colorado, and he's one of our subcontractors and partners. So I do want you to get to know him today as well. Okay, so now we're going to talk about what we learned in the breakout room. Now this is an opportunity for you to turn your camera on, and I forgot to tell you, someone in the room needs to be the transcriber for the next breakout room. So make sure someone transcribes and reports out that you vote someone for that. But right now, we just want to learn what you learned in your breakout rooms. So anyone that wants to join us and introduce someone new they met, someone they didn't know their work before, or they didn't know them. If you want to share what were some of the common concerns that you had in your breakout group, and anyone that came up with any inspiration or encouragement during their breakout room, please take this time to kind of join us in camera and speaker and let us know what you learned. Who wants to go first?
Okay. Some of our group isn't very knowledgeable. 3 of us aren't as knowledgeable in this, and so it's always nice to have resources and have a beginning. You know, if something comes in, we have a starting point, we know what to do. So it's a good learning opportunity for us.
Thank you, Daleen. That's perfect. Yes, I do hope. I mean, some of you may not even be doing this work and just are here for basic information. So we want to make sure that you're getting a full learning, and we just want to introduce the concept and let you kind of do with what you will with the information that we're providing. Did anyone meet someone new that they hadn't met yet?
Yeah, I met 2 different folks. I met Erin Cowett and also met Coralia. So we were just talking about our different works in different counties and, the differences of, secondhand smoking and tobacco between rural and urban communities.
Perfect. So Alberto, can you use your camera? Do you have functionality in your, there you are. I just want to see you, because Boulder is funded in 2.1. They do a lot of work. So I want you guys to acknowledge the folks that are doing this work and that have gone down the road a little bit further. And I want you to refer to them as peer mentors, because these are the folks that you learn from. So thank you for turning your camera on, Alberto. I just wanted them to see you. And thanks for joining us today. Would anyone else like to say anything inspirational that they heard today in your breakout room? Anyone that has like hope or encouragement today? All right, well, let me be the hope and encouragement for you. I know that yesterday we had a really heavy meeting in our public health, and I'm sure some of you guys have had these meetings as well. Some of our federal funding has been taken away, and even though the state funds are not affected, we are affected because our friends, our health partners are looking at maybe losing their jobs. And we've all been through this before with STEP funding. Grant funding is the way it is, right? So I encourage you to just try to, think positively and try to be, the little engine that could here. And we do whatever we can in our local area. But I think what's happening recently really points to the fact that we really need to firm up our local policies, like getting our local policies embedded, then it's, then it's our state policies, then our federal policies. But once we have those, our ordinances and our local policies embedded, those cannot be messed with. So it's really important. Yes, Bianca, that'd be great. Okay, so let's go ahead and get started, guys. Let's start with the problem and the response. So how can we overcome skepticism to help build partnerships between public organizations, housing authorities, and housing providers? So this is where we are, overcoming skepticism. So let's talk about, I found this and I thought this was perfect. We really have to build relationships with our housing providers. No one wants to work with the health department unless there's something in it for them. So we have to build trust with these folks. That's why they're not talking to us and we're not working with them. So Bianca, would you mind launching the trust model? What I've done for you guys today is made little kind of handouts with additional words because I can't go real deep into these concepts. I'm going to give you supplemental materials and you don't have to read them now. This is for you to save what you want. Don't save it. I will be sending it out in a zip file later for you to have as well. So the trust model in building relationships with housing provider, it starts with transparency. So we openly share information and our intentions. We're being honest we're honest about our challenges and avoid hidden motives. So that we want the housing providers to know exactly where we're coming from and why. And then our responsiveness. So we want to make sure that we're reacting promptly and effectively to all concerns. We answer all questions and we offer feedback. So this is working with both individuals as well as housing providers. We don't want a complaint to sit for a month before we get back to them. So responsiveness is very important in this line of work. And then we have to have a basic understanding of where they're coming from, right? We have to actively listen to their concerns and their perspectives to ensure that people are heard and validated. This is 90% of this work for our community members, is like hearing them, hearing their frustration, letting them vent, and then trying to support them through that, right? Whatever that looks like. Then we offer the support. So we provide the resources, we provide guidance, or we assist them to, assist individuals to navigate the challenges or their changes. And this may mean not making the smoke stop, but how do we help them other than that? Like, can we help them, encourage them to like move? Sometimes people really do need encouragement to just say, this isn't going to change. I need to find a different housing for my health. And then being honest is very important because we uphold integrity by sharing factual, consistent, and trustworthy information. So this is where we lean on our best practices to really offer suggestions and resources that are steeped in science and experience. So what we found in the work that we're doing, guys, is there's a lot of solutions here, but the best solution really that covers everything is a smoke-free policy. There are misconceptions associated with this. When we talk about in session 3, we're going to talk about kind of combining our information with our internal teams. One of the teams that you will probably work with, which makes sense, is your indoor air quality folks, right? This is going to be environmental health or environmental quality. There is no real indoor, I mean, Denver is one of the biggest health departments in the state, and they have no indoor air quality department. So no one's really doing this work. In Fort Collins, and I think Dominique's on the call. Fort Collins, we went to see their college there. They're working on an air filter, and they have great stuff going on, and great things are happening. And an air filter will be able to reduce the toxins in the air, because if you look at the overall air quality, and secondhand smoke is part of that, it will be able to reduce the overall quality of the air, like the particulate matter, the VOCs. But we know from ASHRAE's statement, and could you launch that, Bianca? Thank you. So we know that ASHRAE says there's no safe level of secondhand smoke. So this is why we don't have safe levels of secondhand smoke. Like we don't have that document. We don't have that number because there are no safe levels. So even if your health department is saying, hey, let's go into this contract with these filtration people and improve this air quality of this building, yes, that may be the fact. Also, a smoke-free policy needs to accompany that because there's no way to get rid of the gases and toxins through air filtration systems. So yes, improvement, not a solution. So what's our understanding? Let's talk about the health impacts of smoking. When we talk about the health impacts of smoking, we wouldn't want to be population specific in this area. Like, you know, you start with who's in the worst category, who's getting hurt the most, right? So we want to particularly look at these different categories. Seniors who are highly susceptible to secondhand smoke and unfortunately are a high level of smokers. So their rate in smoking is also pretty high. And then we look at families. We have a lot of single family not condos, but apartment buildings where like single mothers, single fathers raising their children. These buildings are very important that they be smoke free because they're housing our beautiful little children. So we want to make sure we're looking at these family buildings. And then we want to be able to support our veterans as well. Again, a high rate of smokers and often without smoke-free policies. And then persons with disabilities. This creates a real concern because you might have a person with a disability, a mobility issue, and they may be a smoker and they may not be able to get outside to smoke. So how do we support someone with mobility issues or a disability that may not be able to get outside to smoke and is at risk of losing their housing? These are some of the things we want to be concerned about. So let's talk about the lovely cigarette. These are the things that we're talking about here. It's not just the individual that's being affected. It's all these chemicals that are off, the gases that are off-putting from that cigarette after it's being consumed. I do know, and I'm going to tell you that if you do a presentation for housing providers, they love this image. So this would be an image, although this is a kind of adaptation of CDC's image. You can use my image if you want. But this is good because it just shows really like we're breathing in rocket fuel, insecticides, vinegar, poison, batteries. Think about it in those terms instead of these scientific terms, right? So what is a cigarette? So what is in a cigarette? So we know that there's over 7,000 chemicals in a cigarette. We know that at least 250 of those chemicals are known to be harmful. And at least 69 of those chemicals are cancer causing. So what types of exposure do we talk about here? There's three types. There's firsthand smoke. That's the smoke that comes off of the end of the cigarette from the individual that's smoking. Or that's the smoke that the person inhales. I'm sorry, getting that wrong. And then there's secondhand smoke. That's the off-putting gases and smoke that's coming off of the cigarette. And I can remember way back when the first time I introduced the third type of exposure, and it was 74 people in Alamosa, and they almost took me and Teddy out of the room. They were like, "Give us a break. Are you kidding me?" But it is true. Third-hand smoke. So that is the smoke that settles on the apartment. I've had someone almost get evicted because the third-hand smoke in their apartment was so strong that they still thought they were smoking. So these are these gases and the toxins that settle on the carpets and the curtains and everything in the house. You'll see that yellowing. This is extremely dangerous for children that are crawling around the floor and touching surfaces, as well as our pets. So what are some of the challenges that were mentioned in the Surgeon General reports that address disparities? So there are intersectional issues that are linked to socioeconomic status and race amplified disparities in exposure. The protective effects of higher socioeconomic status are less pronounced among Hispanic people, Hispanic adults, meaning it really, the smoking rates don't depend on if they live in a high or low socioeconomic status building. And smoke-free protections, they are unevenly enforced. This is the key right here, guys. Smoke-free protections are unevenly enforced, particularly in rural and underserved areas, and it is exacerbating existing disparities. So let's talk about third-hand smoke for just a minute. What's the impact of third-hand smoke? So pesticides, it's what is in it? It's pesticides that kind of settle on the wall. So you can see in that little image there, the yellowing effect on the wall. And then particles they embed in, I can't see the small thing. Anyway, they have offsetting VOC gases and they can damage the property. Combining nicotine and combines nicotine and other toxins. Oh, it's a synergetic effect. Nicotine kind of engages with the other toxins in the air, and it actually exacerbates it. And nicotine may be restricted with other, may be very reactive, that's right, to other particles. So in other words, the VOCs and the offset gases, they all get together with all the other, just like air conditioning. Air conditioning makes the VOCs higher. So this is all science that you need to know about, but I'm not the one to tell you about it. So research that some more. So here's another, this is I found this on the internet. This is really great about third-hand smoke. So people who don't understand it, but most of the content is going to be at the end, the last 2 minutes. So I'm going to go ahead and kind of start the introduction, and then I'm going to scoot ahead. But let's see, first of all, if we can hear. Good video, huh? Okay. So what about secondhand vape? I have responded to a complaint in Denver where a gentleman says he was being exposed to secondhand vape. When I went into his apartment, he was having all kinds of skin irritations, and he had all kinds of white residue all over his apartment. He lived next door to the vapor. So we are also experiencing secondhand vape, some of the property damage to secondhand vape. Nicotine also causes that yellow staining. The nicotine is what causes the yellow staining. So that is also in vape. So you also get that staining through vape as well. Vape does contain less harmful chemicals, but it still contains a large amount of chemicals that settle on the surfaces as well. And secondhand vape does not have as long as the clear time as combustible tobacco products. So it tends to hang around a little bit more. And this is a vape video, but I'm going to send you a link to that. I think it's good information to know, but we're going to move past it for today for the sake of timing, because we've had some technical issues. So what about marijuana smoke? We talked about that earlier, 26% smoking rates in Colorado. Marijuana, smoke is smoke. And marijuana smoke is the form of indoor air pollution as well as tobacco smoke. Marijuana is not allowed federally funded buildings under the Controlled Substance Act. Bianca, would you mind launching that Controlled Substance Act supplement? So there's more about this in the supplement. It can explain to you about the laws that will federally require public housing to ban marijuana because it's not federally legal. So HUD has gone back and forth on that, but to this date, without a reasonable accommodation to use, which I haven't seen one, it is illegal to use. I do feel like that will be changing very soon, though, because they're trying to declassify marijuana from a substance one lower. So if they declassify marijuana, then of course it'll be federally regulated, federally legal. So what we're finding here is there's a whole bunch of stuff we can be doing, but policy is the number one solution to this issue. The benefits of a smoke-free policy for housing providers. So some of the things to talk about when you're talking to a housing provider who may not have a policy is as a public housing for the health effects, right? If public housing in the United States was made smoke-free, all of it, it would save $153 million every year. So that would include $43 million in the cost from cleaning. These apartments and condos can run up to $15,000 to turn over a smoker's unit, as opposed to about $3,000 for a non-smoker's unit. So this is a huge cost to housing providers. And we know that $16 million is spent in fires that are caused from smoking. There are options for housing providers to receive lower insurance rates if they have a smoke-free policy that is well enforced. So savings would be even greater if all multifamily housing across the country went smoke-free. So again, policy is the key to success. Some of our policy goals are to prevent it. Number one, it prevents initiation of tobacco use, especially among young adults and youth. So imagine if you lived in an apartment complex where Joey, Benny, and his friends are always out, smoking cigarettes, and the kids are walking through that, coming home from school, whatever. This is normalizing. So we want to make sure that kids are not being exposed visually to smoking, or definitely from the effects of the secondhand smoke. And then it promotes cessation and it assists tobacco users to quit. Again, if you're trying to quit and you're constantly smelling it in your apartment, that's a trigger. And that's not going to work. And let me tell you something about cessation. If you get someone to go outside, a smoker to go outside and smoke, you have improved the indoor air quality because you're getting them to go outside. If you get a smoker to quit, they're never going to smoke inside again. So that smoker that's learned to go outside, he or she may smoke inside on a snowy day. But if he quits, he won't smoke inside on a snowy day. So the key is really to get them to quit. But if not everyone can quit. So getting them to move outside would be the next step, right? And then goal 3 is to protect people from secondhand smoke. Again, if they can't quit, let's look at a plan to get them to smoke outside. So we know that smoking policies are legal in Colorado. We know that they're supported by the National Center for Healthy Housing and Disease Control, this formerly known CDC. And we know that they are required in public housing. You don't know that yet, but I'm going to tell you. And they are encouraged in all subsidized housing. So smoking policies are not a violation of people's rights. They are not discriminatory. Smoking is not a disability. They do not violate individual rights, and smoking is not a protected activity. So we have model policy standards that we look at and recommendations for people who are adopting a smoke-free policy. We have created a smoking definition. We want to make sure they use that smoking definition. We have a minimum perimeter of smoking around 25-foot perimeter. That can be, we're going to discuss that perimeter later. It varies in HUD buildings and in regular buildings and non-HUD buildings. Prohibits smoking in most areas outside the buildings. So that means common areas, mailboxes, and things like that. It should contain a legal disclaimer which says we're not guaranteeing 100% smoke-free air. And then the Colorado Clean Indoor Act prohibits smoking within 25-foot radius outside the main or the front door entry unless defined differently by local laws. We're going to get into that in session 2, and we're really going to talk about those perimeter rules, the difference between HUD and non-HUD housing. So some of the existing laws that govern, I said earlier, this is very difficult for us because there is no law to guide. There's no guidance. So we're just, kind of moving along as we learn. So the Colorado Clean Indoor Act is going to be the main law that will protect people from secondhand smoke exposure. So to reduce the risk of secondhand smoke health problems in Colorado, the General Assembly passed the Colorado Clean Indoor Act in 2006. It prohibiting smoking in indoor areas and throughout the state, and then it was updated in 2019. And so the mandated laws here, the only mandate we have on secondhand smoke or smoking in a building is going to be through HUD. HUD Housing and Urban Development developed a mandatory smoke-free policy in all public housing. We're going to talk about housing types in a bit in 2018. And then the rest are voluntary, which is property owner's choice. And that also means property owner's power. Welcome back. Would the scribes please turn on your cameras and let's talk about this complaint. And I do apologize. I had different complaints for you guys, but you all ended up with the same one, which will be interesting to see the different conversation. But in our next breakout room, everybody will be working on a different complaint. So the report out should be very, very much different. So the complaint that you dealt with today was Westminster. And did we have anyone from this county on the call? It's you, right, Alberto?
Well, Westminster actually is not
No.
part of Boulder County, but we work with
Is it
them
Wells?
closely sometimes. Yeah.
Okay.
That's
Okay.
It's Adams.
Adams. Do you have any from Adams County on the? Ashley, I think your camera mode, your screen may be closed because you have a black screen.
Oh, sorry. Give me 1 second.
That's okay. I did that all day yesterday to Bianca, and I was like, "You just talked to me with a black screen and it's saying." Okay. Who wants to start first? Who was described for group 1, room 1, breakout room 1? Is no one in breakout room 1?
I think I was. I believe I was. Okay, what was the question?
So, what did you guys decide on this? What was the setting involved? And I forgot to tell you guys that you can Google these properties. So the best way to find out the setting of these properties, I just Google it, and I just take a look at the property and see what it looks like. So I don't think
So
you
we
guys Googled it. Did you?
Yeah, we did. Yeah, once you told us to.
Okay. So what was the
'cause I was
primary
thinking-
setting?
It's
And you don't have to
in
be
town.
right. It's
The city. It's in
City?
the city. Apartment building complex. Very nice looking.
okay. So probably market rate because
Like how much?
of the way, the way it looked. And then let me just put up here. So did you get an idea of what the demographic area may be? So do you think this is probably a higher SES?
Yeah, I mean, some of the rooms or units are going for like $3,500 a month.
Okay. Okay. What is the primary issue that the complainer, from the complaint that you saw, what do you think the complainer's primary issue is?
Not being able to breathe and the landlord not helping out with that issue.
They're not getting a response from their landlord. And so what, if any, response or circumstances may be present in this situation that might affect your response? Anything?
Not, she didn't want to get penalized by getting out of her lease.
Of her lease? Okay. So from reading this, you kind of assume that the person might want to move?
Yeah.
Okay. So, okay, great. Thank you. That's very good work. Who has room 2? Who's described for room 2?
Peggy, before we move on to room
Yeah.
2, did you want to pull the slides back up so that we could see those questions again?
Oh, yeah. I'll just talk through them.
Okay.
They're real simple right now. I just want to be able to see just kind of have a conversation for just a minute, and then I'll pull that back up.
Okay,
So I'll
sounds good.
kind of prompt them. I wrote down settings, demographic, and sum up primary concern, and then special circumstances. Thank you, though.
Right, I was in room 2.
Huh?
I was
You're
in
in
room
2?
2.
Hi, Ashley. Good to see you.
You too.
Okay, Ashley, we worked together on this. I'm expecting you to get these things kind of right. You did good. The last group 1 did great. What setting do you anticipate this might be in?
I mean, I don't think it's public housing. I think that it's the normal market housing apartment complex. They do not have a no smoking policy based on their website. So that part, becomes
Good.
a little difficult, but it sounds like the person might even realize that, saying that they want out of their lease right now.
Mm-hmm. Mm-hmm. So the primary concern then is lack of policy, and they want to move.
Yes.
Okay.
And so even if they want to move units, though, I mean, that could always be an option too. I'm working with someone right now trying to see if because they're going to waive the transfer fee if they want to transfer to another unit, but you just don't know if there's no smoke-free policy, they can move into a building where the smoking is 10 times worse. So you just never know.
Exactly. So so you're talking through this and you're like, okay, I can get this person to move to another unit, but the chance of them being exposed again is pretty high, right? So what would be your primary like movement on this? What would be your number one goal?
Trying to get the property managers to let them out of their lease without any penalties. And maybe
Perfect.
give them, recommendations for smoke-free properties nearby then too, saying this one has a smoke-free policy. It sounds like they enforce it. So doing some back end research on that too, just so that, make their transition a little bit easier.
Very good. And so the special circumstances then it would be that they don't have a smoke-free policy. So there's really nothing to enforce if there's nothing to enforce, right? Yeah. So it's working with the housing provider after this. And then as far as if we go back to the trust model, what would be our conversation with the individual that put in the complaint?
Explain to them, what could happen, what the outcomes could possibly be, and that because there is no smoking policy in place, that, we can try to educate the housing provider about, maybe potentially getting one, which I know a lot of them don't want to try to enforce one or implement one right away, but just, telling them what their options are and explaining to them, this could take a little bit of time, but we're going to work really hard to work with the housing provider and, let them know that this is something that is an issue and that there are, people have the right to breathe some air. So they should let them out of their lease.
Right. Now, what would you want to get from this individual before you reach out to the housing provider?
Definitely any kind of interactions they've had with the housing provider before, what kind of conversations have they had, what options have they explored, because you almost want to show that they've exhausted all their other options. They've, maybe talked to their neighbors or something. We've talked to their neighbors for them, or, that they're really trying to make this work and try and do what they possibly can, but there's just no other options.
Perfect. Now, in addition, that first conversation, you want to make sure that you get the go ahead from that individual to engage with their housing provider on their behalf. If they say no, I'm afraid of retaliation. We're going to get into that later, but do not respond because they've said no. But you need to be, again, the trust model, go back to transparency and say, without talking to the housing provider, there's little I can do. And then assure them that you can talk to the housing provider, not saying their name. You're not going to reveal who's complaining, but you're working with the housing provider. So if they say, no, I'm afraid, you can say to them about the warranty of habitability protects you from retaliation from a housing provider, but you can't guarantee that won't happen. So you just want to make sure that if they're not comfortable with you moving ahead, do not move ahead. Okay. All right. Group 3. Who's my scribe there?
I don't think we assigned a scribe.
Was that your room, Pete?
Yes, it was.
Do you want to talk about what you guys, what kind of setting did you guys think this might be?
Well, we didn't really talk about the setting. We just talked
Okay.
about, how it's going to be respond.
Okay, tell me about.
I think one of the questions that came up from Jennifer, which was a good question, how does somebody get out of a lease? But we did talk a little bit about before you start, make sure you find out the comfort level of the person complaining. And I think from El Paso County, they talked about how they've had similar cases as well. So I don't know if anything's changed in terms of getting out of the lease. I know it used to be, from what I understand, it was basically you have to look at the lease and see what what it says. But Colorado law allows you to get out of the lease, but you also have to look at what you may have to pay a penalty to get out, and see if you have to give a certain number of days to get out. That doesn't mean you can't still get out under what they call constructive, eviction clauses, which allow you to get out because there was a problem. So, do you know if anything's changed in terms of because?
Well, we do. We ask for mutual rescission. So here's the thing that you would do. If someone wants to get out of their lease, So we say, well, you could ask for mutual rescission. It's
Right.
not great to ask right away. It's best to ask that on like the second time around. So the first time you ask the housing provider to address the smoking situation. If it doesn't get better, then you go back and you say, we complained 30 days ago, the situation hasn't improved. We have a list of attorneys, we have a list of mediators. This is something that probably needs to go to mediation, but a reasonable, what did I put? I'm sorry,
Rescission.
yeah, thank you. A mutual rescission is something that can be requested by an individual. It can be requested or agreed upon in mediation, or it can be requested from an attorney. They all have different weights, right? But we can assist them with part one, which is giving them the reasonable accommodation request for mutual rescission. Again, session 3, we're going to talk about this. So if you want to know more about that, session 3, we're really going to flesh this reasonable accommodation out and a request for these on behalf of our residents. So don't get too confused right now. It's just identifying. That's all we're doing right now. Thank you,
Hey,
Pete.
Peg,
And this
hey,
is,
Hey,
go ahead.
So
Peggy,
Peggy, oh, I'm sorry. I
No,
just
it's okay,
had a
Jennifer.
quick question also, and Pete, is that his name? He said it was probably more of like a legal question, but maybe
Uh-huh.
you can answer it. So I was also wondering too. So okay, say we make this into a policy, is there a way that we can put, like, make the landlords, because it's policy, put something on the lease? And then that also falls in the same hands as if we want to do like a 25-foot away from the front door into the policy and then put that on the lease also. Is that like a legal
So
talk
the
or?
housing provider can put whatever they want in their policy. They're creating a policy because it's a voluntary policy.
But
What
if
we
we
refer,
make it a local policy, is what
oh,
I'm
so you're
saying.
talking about like an ordinance.
Yes.
Okay. Yeah, that is the conversation for our policy folks. But yes, that's exactly what we want to lead up to, right, Jennifer? Is if we have a local ordinance, and there is a video out of Denver, out of California. Their Healthy Housing Coalition has come up with a municipal ordinance, which I think is fantastic. It actually takes they also recommend taking eviction, like the smoke-free policy would not be a termination offense. So
Right.
it is not connected to the lease as a requirement of tenancy, if that makes
Okay.
sense. So
Mhm.
they can have a smoke-free policy that doesn't lead to eviction. I know that Adams County, I talked with Casey McAndrews, is working with people right now to talk about that. So the ordinance that you would design would be something that would be based on the model policy, and it would be based on, we've talked with a lot of different counties. Can we put a fine in there? You can't fine individuals for violations. There's law against that. So there's a whole bunch that goes into the ordinance that would be considered. But Jennifer, you are on the right track. What we need to do is find a way to handle our housing situations locally. And so if we want to do that through an ordinance, that's great. We're also going to talk later about, like a rental license that would have a component to help you respond to secondhand smoke complaints, or talking to your environmental health, or it could be a zoning issues. So there are other ways that we can look at this in existing current situations that we have within our public health departments that may not require an ordinance. But if your county is leaning that way and you want to help develop that, definitely talk to the policy folks. Start with Raya and talk to the policy folks about what might be next steps on that to determine readiness and where you may go with that. But definitely that's a session 3, and we definitely want to talk more about that because it's exactly what we want to do.
hey, Peggy,
Okay.
Yeah.
Thank you.
it might be good. Some people may not know what mutual rescission means. It means when all parties involved in a contract agree to cancel, terminate it, effect that releases each other from the obligations as if the contract never existed. So that's what that is.
Yeah. And we just helped someone with one of these, and she did it on herself because she Googled and she had AI like be her attorney. And the letter was hilarious. We're going to work on that in session 3, how to take a bad request and turned it into a hopeful request. So again, that's a third level advanced work, and I don't want to confuse individuals on this introductory training with too much language that I already have used. That's confusing, so I'm sorry about that. Okay, breakout room 4. Did you guys discover anything different, or what were your thoughts on this complaint as far as the setting and what possible circumstances might be concerning?
So we mostly just talked about like how we would address it, because with just like legal stuff, none of us were really sure, I guess, like how to approach it besides speaking with the property manager or something. But besides what everyone else said, we also mentioned that it seems a little obvious that the tenant does want to move out. And so, but another thing that we were considering was typically when it comes to this kind of thing, like I typically ask for, like if I ask the manager themselves, like if I can have a sample or something of their smoke-free policy, if they have it, just to see what details it already consists of. And then essentially once I review the policy or like what's written into it, I then come back and ask them if they're willing to develop I don't want to say like a better smoke-free policy, but I just don't have a good, like, lack of a better word, so I'm gonna use that language. But just if they want to develop a better smoke-free policy, and I basically we give them the tools for it, let them know like this is how it would go, and then also let them know that like if they have any questions about how to implement it or how to, like, if they need any resources, just tell them that like we're always available, and to give them our contact information. That way if they have any questions, we can address them, because like you kind of, in my personal experience, you kind of always have to assume that like they might not know about these policies or they're not super well versed, and so it doesn't hurt to have additional resources. And so we also mentioned providing like I guess like citing the laws where like tenants are safe under the law, or about how basically just the laws that you mentioned like a couple slides back. But yeah, really just like asking if they want to develop a more enhanced smoke-free policy. And if they do, great, we can help them with that. But if not, there's really nothing we can do. So that's what we discussed. And group, if I missed anything, please say so.
Yeah, so what Nikita's talking about is expanding the policy. So if there were, I'll give you an example, there was a building, I think it's in Arapahoe, I can't remember. So the building is 3 stories, all the bottom stories have patios. So this housing property had a policy. They had a smoke-free policy. Patios were not included in the policy. So they were legally they were allowed to smoke on their patios. The complaint we got was people being exposed on the higher levels from the patios. So the grantee thought perhaps this is a distance requirement, right? There's no smoking within, if it's a HUD building, there's no smoking 25 feet around the perimeter of the building. Do those patios, where do they fall in there? So these are the kind of, you have to really kind of suss all these kind of details out to find out. Of course, a site visit would help you determine that, because you might be able to visualize people smoking on their patio. But your movement would be, like Nikita said, to have them expand their policy. So if patios weren't included, you'd want to have that conversation with the housing provider to say, hey, have you thought about expanding your policy to 100% smoke free, which would include the patios, and that would stop that secondhand smoke drift from entering the other apartments. So those are some conversations, again, we'll have in session 3. And these are also things that these are not common. So the details aren't common. So this is where you go to TA and you're like, hey, I have this uncommon situation. Can you walk me through it? I'm happy to help you. Raya's happy to help you. Pete's happy to help you. So if you get a situation where you don't even know the starting point, just contact us and let us know, and we'll get you started. But also remember, when you're asking a housing provider to look at their policy, often it's best to get the policy from the individual that's complaining, because sometimes when public health asks a housing provider for their policy, it's kind of asking someone to look at your bank account. They're like, ooh, I don't know you well enough, So you want to make sure that before you go into that with the housing provider, that you've developed that relationship through that trust model. So they're transparent, there's trust, and there's understanding there. So make sure that you have a relationship with that housing provider before you dig into details with them. Okay, room 5 is our final room. Do you guys want to report out? And thank you, Nikita. That was very, very informative. Perfect. I'm glad you're in that room. Anyone else want to share? It's from breakout room 5. Okay. Breakout room 5, did you have a conversation? Hey, Raya, are you on the call? I was going to introduce Raya real quick, just so y'all know who she is. Okay, not hearing her. All right, so I didn't really give you guys a timeline. We're going to break for lunch. We're going to have like a 20-minute break. It's for you guys to grab coffee, go to the bathroom, and have something to eat at 11:50. So let's go ahead. It's 11 now. Let's go ahead and go through a few more slides, and then we will take a break for lunch. Let me start up and let me start this. And Kate, I see your face. Can you see the screen?
Yes.
Good. All right. Let's go ahead, present in Teams. Let's see if that stops. Boop, boop, boop. It seems like a different. Bianca, this looks like a different view than I had before. Can you see my screens? Can you see all the notes and everything?
Yeah, it looks like presenter view. If you click on present
Okay.
in Teams at the top, what does that do?
Let me stop sharing here and try this again. Sorry, guys. Yay, better.
Okay.
So let's talk about the response, how to respond to a complaint. So what are some of the questions that are asked of us in some of these complaints? These are just common. It definitely doesn't cover everything. What can I do to protect the health of me and my kids? So I've complained and nothing's happened. My building does not have a smoke-free policy. What should I do? My building has a policy, but people still smoke inside. I live in a HUD building. Shouldn't it be smoke-free? I'm afraid of retaliation if I speak up. So these were all things we discussed in that last breakout room. What can I do to protect my health, the health of my kids? So this individual is absolutely looking for support to reduce the secondhand smoke. I've complained, but nothing's happening. This is a very common. Housing providers don't often do anything about it, or they will do an email to all the residents reminding them of the smoke-free policy, but they do very little to address the individual exposure. And then if your building has a smoke-free policy, my building doesn't have a smoke-free policy, then that's even more work, right? That's work with the housing provider, because we have to get them to adopt a smoke-free policy and to convince the housing provider that it's a benefit to them. And then if they have a policy but people are still smoking, it's probably because they don't have an enforcement strategy. These are the things that we can help housing providers with, is how to develop an enforcement strategy that's consistent and reliable. And then if they live in a HUD building, it should be smoke-free. but only if it's a public housing HUD building. So some people are very confused about the type of building they live in. If they're a voucher, they do have HUD funding individually, but it doesn't apply to the property themselves. So these are some things we're going to talk about in session 2 and session 3. And then we talked about earlier the retaliation. I'm afraid to speak up. There are many, many, many people out there, guys, living in apartments that are very afraid to even ask for water or plumbing because they're afraid they'll get evicted. So these are realities, and we need to take these in consideration. And this is exactly why you make sure that individual is comfortable with you talking on their behalf. Or talking anonymously to the housing provider before you proceed. Okay, so let's talk about this little wheel. We're going to talk about how do we do this? What is expected of us and what is the process? Brittany, why do I want to keep calling you Brittany, Bianca? Could you launch the guidance document? I know you sent it out during the breakout room.
Yeah, I can post it in the chat.
Yeah, and did you launch challenge and barriers? That was in slide 11. I just want to make sure they have the challenges and barriers. Thank you. Again, you guys are going to be getting these documents in a zip file later, and I think the housing types as well. Okay, so the first thing is receive the complaint. If you look at the guidance document, we're going to go through that real quick. So if you guys want to pull that up, I'm going to pull it up here. If I can find it. So you all, this is all the guidance document is on the Tobacco Free Colorado website. And basically, you can write your whole process just following the guidance document. Everything you do on the guidance document is a process step. So when we start with receive, there's a couple of things you need to know about the receive. You want to know who's going to receive the complaint, and then we're going to refer to the step guidance document. So do you have a tobacco team? If you don't have a tobacco team, but you have a dedicated individual that's doing this work, that's going to be the individual that receives the complaint. There's another component into receive. It was, how are we going to receive the complaint as a public health department? Are we going to receive the complaint ourselves, or are we going to receive the complaint from the state? So there's a couple ways you can do this. On your website, you can have a reporting tool. Now there are tabs. So the reporting tab can either be your website, goes to your website and your reporting, or you can just use the Tobacco Free Colorado link and it'll link it to the state, and then the state will send it to you. So clearly, the fastest way is to have it come straight to you, right? So Boulder has a tab. They have their own complaint collection. Denver has 311. So if you do this, if you choose to receive the complaint yourself and not go through the state reporting, make sure that you are at the end reporting this work to the state in your QPRs, because we only have knowledge of it if it comes through the state. If it comes to your individual health department, we don't have knowledge of it and we can't track the data. So it's still important that we're receiving that data because we want to know about all complaints that are coming in. But if you have a very small system and a very small team, the best option is to just, are you being exposed to secondhand smoke, and put the Tobacco Free Colorado tab on there. And if you're confused about all this, contact me and we'll talk about it one-on-one. So now that we know how we're going to receive the complaint, we're going to talk about the next step, which is research. So what are we looking for? So we practice this in the workout room, right? All you get is this minimal information. You can Google the property and get more. You can definitely consider the demographic and the setting. If it's HUD funded and it's a public housing property, it's sometimes harder to tell, but you'll know because it'll say like Pueblo Housing Authority, Denver Housing Authority, those are public housing. So those are the people that are mandated to be smoke-free. And those are the people that you have a leg to stand on because they're required to have a policy. Plus, their funding is at risk if they don't keep it smoke-free. If they're not responding to complaints, their funding can be, it could be detrimental. And so sometimes they often get awful angry at residents for complaining too, because it does put their funding at risk. So this is an issue, a situation where retaliation, it might happen in public housing. So be aware of that. So determining the type of complaint, what you want to know is who's complaining. Is this a community member? So what is the setting? Is this a business or a public housing setting? Is it a business? Is it public, or is it a housing setting? When did this occur, and how chronic is the complaint? And when I mean chronic, I mean, like, is this happening every day, or is this person just smelled it once and they're complaining? Not many people complain once they smell it once. So most times these are chronic conditions, but not always guaranteed. And what type of housing setting is this? And we're going to go through those housing settings so you guys have a little bit more of an understanding of what that might look like. So here we go. You get your complaint. You got two roads to go down: public business, public setting, or housing setting. So where does this complaint fall? The reason this is important, guys, is because the Colorado Clean Indoor Act, it supports protections in public areas. But it doesn't support protections inside individual units. There are areas in the Colorado Clean Indoor Act that we can rely upon, like the perimeter 25 feet from the building. All common areas must be smoke-free, no smoking in the hallways. It's important that you kind of understand what part of the Clean Indoor Act covers housing. So I would suggest that you go to the Smoke Free Colorado fact sheet. This is also posted on Tobacco Free Colorado. This link is live, so you can click on that as well. And we want to define, like, what is covered in the Clean Indoor Act that refers to housing. So you need to understand the restrictions. Smoking and vaping of any substance is banned in nearly all indoor public areas. So we know that restaurants, hotels, well, I haven't getting that yet, grocery stores. So retail and commercial buildings, restaurants, bars, hotels, and motels, all covered. Now, the hotels and motels are actually an amendment from 2019. So you might actually get a complaint from a hotel that still has smoking rooms, because we did last year have a complaint in Adams County from a hotel that still had smoking rooms. They didn't even know they were supposed to be smoke-free. So this could possibly happen to you. So hotels need to be smoke-free. So public, private schools, museums, theaters, libraries, and meeting rooms, and then grocery stores, gyms, indoor spaces, and auditoriums. So you would know if you walk into any of these places and someone lit up a cigarette, I would be straight to the manager, like, they're smoking over there in produce. Like, no one should be doing that. This is where we want to get with housing, right? We want these social norms. This is what we call it. Once everybody agrees this isn't right, that becomes a social norm. People don't smoke indoors. So we want that social norm to carry into housing. This is why we talk about the health effects and the dangers, and that we fight for these individuals that are being exposed when they don't want to be, because it is an attack on your body as a person, and it should be defended. So lobbies, hallways, restrooms, and common areas are all covered in housing. Healthcare and children's facilities. All business, regardless of employee count. It used to be you had to have so many employees before it went into effect. Now it's all businesses. And then again, from the amendment 2019, the assisted living, nursing homes, and similar residents. And I also have a supplement for you on assisted living, and that I will, I don't think I gave that to you, Bianca, but it's going to be in the zip file. It explains a little bit more about assisted living and the requirements there. So let's go into housing settings a little bit. Let me look at time, 11:18. Okay, we're good. So one of the main challenges we have, in my opinion, because this changed while I was doing this work, we used to have supportive housing settings. Now we have a housing first model. So the housing first model is a supported housing with rapid access. It's considered rapid access without barriers. So some of the barriers that were broken down, which I think barriers should always be broken down when possible, it moves people quickly into housing from the streets or the shelters. And then it requires minimal eligibility on what the funders or landlords require. And there are no requirements for sobriety, treatment, or medication compliance. This is the change that got really hard for us to connect with those individuals, because used to there was a requirement that you attend 3 classes a month to maintain your housing. And in those classes, we could usually do a cessation opportunity. So a cessation class to help people quit or learn to smoke outside. And now there's no longer a requirement for them to attend those classes. So those classes are not very well attended, if attended at all. And participation services is optional, not mandatory, like I just mentioned. And yeah, I was going to, we were going to do the breakout room, Bianca, at 11:10, but I am going to go through these slides, I think, and save the breakout room maybe until we get back from lunch through housing settings. So let's talk about public housing. And I have it on there easiest. Let me just say, nothing about this work is easy. So it's easiest in comparison to the rest of the work that we have to do. And the reason it's hard is because this is all about communication agreements. Communication agreements it's just difficult to achieve sometimes. It takes time. So public housing is easiest because it's owned by public housing authorities. Those are the public housing authorities, PHAs. They often serve low-income families, seniors, and people with disabilities. They are funded by the U.S. Department of Housing and Urban Development, HUD. And HUD mandates smoke-free policies, but enforcement will vary. Again, we go back to the enforcement. And then some of the challenges in this are they have limited budgets, which may restrict cessation programs and physical updates. So what we have is a building with a lot of people with a lot of need and a requirement to quit smoking. So this is your cessation opportunity of a lifetime. This is where you want to make sure you're getting those opportunities because they don't have the money. When you come to them with cessation programs or resources, they're gonna like that because they don't have funding for that. So these are the demographics that need it. So this housing setting would be public housing. And then we move into affordable housing, which is an oxymoron, right? It's like 30% of your income or whatever. It's more detail on housing types on the supplement, but the overall focus of affordable housing is a community focus. They're usually community focused and health conscious. They're developed by nonprofits and for low or moderate income individuals. They are funded by federal, state, and private sources through HUD grants, low income tax credits, or philanthropy. So this is funded by HUD, but not public housing. So it's important to know that distinction because affordable housing is not required to have a smoke-free policy. So the policies they have often prioritize smoke-free housing for health and safety. So they often have smoke-free policies. So resources, you may offer cessation programs and resident education. This is a great group for that. And then some of the challenges in these affordable housing settings is enforcement is difficult despite funding support. So the problem with this group is they normally, if they have a policy, they don't have a structured enforcement protocol to go with that policy. So it's this expectation without information on how to provide the expectation, right? So we want to make sure that we're supporting our housing providers on clarity of their expectation to their residents. And then there's transitional and supportive housing, and this is a little more difficult. Transitional means they kind of are there for a while and then they're moving on. We do find high smoking rates in this type of housing. So it provides temporary or long-term housing for individuals facing homeless, mental health challenges, or substance abuse disorders. The funding comes from federal grants and HUD's COC program, Continuum of Care program. And the state and local funding or nonprofit contributions also help fund this setting. And then policy influence, we have smoke-free policies can be challenging to enforce, again, because there's rarely an enforcement protocol in place. And then programs may integrate cessation resources as part of a holistic approach to health and wellness. This transitional and supportive housing is very ripe for cessation opportunities. So I would definitely, if you want to work on your cessation work, look into this, this demographic housing setting. Then we have market rate, which is basically the complaint that you guys did in the workshop. Market rate is privately owned housing where the market demand rather than subsidies determine rent. So the funding source of this is entirely through private investment or developer revenue. Some smoke-free policies often are market-driven and implemented by housing providers to attract health-conscious residents. The studies show 80% of individuals prefer smoke-free housing. So enforcement is often inconsistent with little oversight. It relies simply on the three-step policy, rarely considering eviction equity. It supports typically focuses on residents facing eviction, smokers, and non-smokers. So in market rate housing, you may get people that are being evicted because of their smoking. So your work may be, how do I protect that individual and preserve the housing? How do I keep this housing provider from evicting this individual? How do I support this individual? Because they will use a three-step process, which is basically 1, 2, 3, you're out, with no consideration of your loss of housing or have an eviction on your records, which is detrimental to families, can make them homeless for 7 to 8 years or longer. Okay, so once we've researched the complaint and we kind of know, like, okay, this is public housing, this is affordable housing, this is market rate housing, this is transitional housing, then we know, like, okay, what laws or what do we have that can help us with this? And that is where we get into our reflect. So we understand where it's coming from. Now let's reflect on what possible solutions could we offer individuals. What are some of the things you want to reflect on? So after an in-person conversation with the individual complaining, does the complaint seem reasonable? So I have in here, after an in-person conversation, you don't have to have an in-person conversation. They're very nice to have, but let me just give you some guidelines around that in-person conversation. Don't meet individuals in their apartments. It is not safe. Don't, meet them in a public area if you're going to meet them in person. It is often best to have a video conference if possible. A video conference will give you opportunity to look them in the face and try to understand if there's some reality behind. You may get complaints, and we'll talk about this again, from people who are exposed where no one else is. And it could be a non-exposure situation, right? It could be someone just wanting to get rid of another tenant. This happens as well. So it's very good to have a conversation with the individual that submitted the complaint before you do any work, because you don't want to dig in on a non-complaint issue, and you really want to find out, is this real? Is it chronic? Does it need addressing? And so then when you go visit the property, and you can visit the property with or without an invitation, hey, load up some swag and go say hi and see what's going on. It's not unreasonable for you to stop in and say hi and offer support. When you're dropping in, you want to make sure you're there for a reason, like, hey, we have a cessation opportunity for you. It can only be a one-pager of cessation opportunities, or just say hi, whatever. Try to get out there. And when you visit the property, what do you observe? You can be there for any other reason and observe the smell. You can observe the cigarette litter. You can look around. You can observe the communication between the housing provider. Are they willing to engage? So when you look at the secondhand smoke, you want to make sure you're smelling, is it alive smoke or is it stale smoke? Some of these buildings are old and they've been around for a long time and they've been smoked in. So they may have a residual, which we call a stale smell of secondhand smoke. It's important to know the difference between the two, because unless they have money to do rehab, you're still going to smell that stale smell. And has this occurred in the location before? So that's important. This is why we track these complaints, because you can be reading a complaint. You're like, wow, this sounds really familiar, especially if you have your own reporting tab and then the state has their reporting tab. You may get the same complaint from 5 different people. Pete will send you one from gas. You'll get one from the state and you get one individually. So it's important to know, like, is this a second complaint or is this the same complaint 3 different times, right? But make sure, and it also can identify a building in trouble. So if you get a complaint in January from a building, and then you get a complaint in June from another person in the building, and then you get another one in November, then guess what? We've got 3 complaints from this one building in a year. Probably have an issue there that we want to look at. So that's why it's good to track these complaints in the location. And then, are there other people involved? So is this affecting? You'll often hear people say, I'm exposed, my neighbor's exposed, blah. So whoever else is exposed, get them involved, have them submit a complaint too, because you have a lot more weight when you come to a housing provider and you say, we've received 3 complaints from this property. We just want to talk to you about your smoke-free policy, how you're enforcing, how can we support you? So it is good to have more than one complaint, but don't say you have more than one complaint if you don't, because they may ask to see them and then you'll be in trouble. And go back to the trust model. Always be truthful and transparent. What's the highest level of impact for community engagement? So that's what you're finally going to come to, right? What is the highest level of impact for community engagement in this opportunity? And that's going to be concerning several different things, which we'll get into later. Okay, I missed one here. Okay, so now we're going to get back to respond. And we're going to slow this down in session 2 and dig deep into each step. So this is a high level overview. So the response, when you respond, and I think I talked to Nikita about this the other day, what can you take with you? So most, well, I know Denver has, and I think a couple of other counties I've talked to has a little folder. It's a little paper 2 folder with 2 pockets, and you can have a nice image on the outside of your community or whatever. You can get these printed up. Inside that folder, you'll have hopefully this multi-unit housing resource packet, which is on Tobacco-Free Colorado. And we wrote this about 7 years ago. It was a combination of work from Boulder, Jefferson County, and Denver. Those are the 3 counties that got together and did, well, Denver mainly, Teddy did the resource packet, but that was combination from all 3 counties. So the resource packet is your guide, right? That's what you're going to use. It has all the signs in there that you can provide for housing providers. It has the enforcement strategy in there. It has individual support suggestions for residents and housing providers. So I would suggest that go in that packet, as well as a letter from, the health department. You send out a letter and you say, hey, we received a complaint from your health department. So when you do your in-person visit, you'll want to make sure you pop that letter in there, because you say, like, I'm just here to educate you on this letter we received. And they'll, oh yeah, we kind of remember getting that. And so make sure that's in there with your business card so they can reach out to you again. And if you have any swag, bring it along, and show up as a helper and not as an investigator. So let's go ahead and get started. So we're going to go through these 5-step enforcement protocol. Then we're going to do a little breakout room, trying to practice some of these concepts. So this is the last concept that we're introducing today. So we're almost done. I want to just preface this by saying this 5-step confirm. You can go ahead and ask me out loud, Bianca. What do you want to confirm? Everybody's back?
No, I just wanted to make sure everybody could still see the screen, because I think I can see it since I'm the co-organizer. But
right, Angie, can you see the screen? Perfect.
Okay. Awesome. Thank you.
Yeah, pretty good. Yeah, if you guys ever can't hear or see the screen, please pop it in chat and let me know. So the 5-step enforcement protocol. When we talk about best practices, the best practice suggested for the enforcement protocol of this smoke-free policy, it's a graduated enforcement protocol that, Angie, yes.
Sorry, just want to say Raya's back if you wanted to introduce her. I saw her pop on.
Okay, great. Raya, I just wanted to have everyone kind of see you so they know like who these complaints are coming from, but it's not a big deal.
No,
Raya.
I'm trying to turn on my camera and it's it was working and now it's not. And my little cover is uncovered. So stand by.
You're a compass.
I'm a compass. Hello, everybody.
You look like a
My name is
compass.
Raya and I'm a compass.
Well, that's Raya.
I'm going to figure out my camera. Oh, here we go. I got it.
There you go.
Hi, everybody.
There she is. Hi. So this is
I'm
Raya.
Raya McIntyre. I'm the smoke-free policy specialist on the STEP team. So I work side by side with Peggy, Angie, Pete, Bianca. We work on all things smoke-free. DDPHE is a wealth of knowledge top to bottom. So you definitely going to them will offer you a lot of support, but should you need more support, always feel free to reach out to me. I'll put my name and my email in the chat, and you can always reach out should you need anything.
Perfect. Thank you, Raya. Thank you for attending today. I know that's hard to fit into your schedule, but I appreciate your time here today.
No, it's okay. I'm literally so excited, Peggy. This is amazing. You're doing great. Okay. I'm really excited.
Oh, good. Thank you, Raya. So to kind of preface this 5-step enforcement protocol, we have a suggested enforcement protocol. It is based on HUD's recommendation. It's followed by American Lung. So I would consider it a best practice as it is a graduated enforcement protocol. It allows the individual to comprehend the expectation and to respond in behavior change to the expectation. That's the point here, right? That's why we like to have the 5 steps. So I'm going to go through these for you. These are not set in stone, but these are what we consider to be a really good opportunity for engagement and cooperation and agreements from both housing providers and residents. So again, like I said, we want a go slow enforcement strategy that supports community compliance and offers cessation attempts at every step. Because remember, a quitter will never smoke indoors. A smoker that smokes outdoors when it's cold, I guarantee you, might sneak a cigarette at 3 in the morning. So the goal would be to get them to quit, but that's not always a possibility. So let's start with the first violation. So the housing provider receives the first violation. This is what we suggest, and this is how you talk about it with a housing provider. So the housing provider would visit the unit, and they provide a copy of the policy and tobacco cessation resources. This is what we call a knock and talk. This is a very casual, hey, Larry, I heard, someone's smelling smoke from this unit. Is everything okay? Is there anything I can help you with? This is not a documented offense. This is simply like, hey, guys, what's going on? Now, if a second complaint comes in on the same unit, that would be a second violation. So then the housing provider would visit the unit and they deliver a written copy of the violation and they provide, again, tobacco cessation resources. Now, I'm going to get with Tiffany and try to determine if there's a standard cessation resource that they would want to offer. What we suggest, and there's a page in the multi-housing resource packet that has cessation resources. You can just copy that and give that to your housing provider. But you also want to make sure you're including any local resources. If you have any, like the public health, Denver Public Health has 5 tobacco cessation clinics. We'd want to include any local cessation resources, primarily highlight those, as well as the quit line in those cessation resources to be delivered at every step. And then the third violation, if the housing provider receives a third complaint on the same unit, the housing provider would send a written copy. Again, see this, they send it at this time and they're not hand delivering it anymore. They send a written copy of the violation with the added requirement for a private conference for subsequent complaints and provides tobacco cessation resources. So this gradually increases in its severity, right? So now you're asked to come to the office and let's talk about this. Now, the fourth violation is after they've come to the office, they're coming to the office and they're talking to you. So you really want to get to the bottom of like, what's the barrier to compliance here for this individual? Do they understand the severity of, losing their housing? So this is where you have a private conference with the resident with a written agreement to comply and provide tobacco cessation resources. So we talk about this as kind of a right to cure step. So this gives the individual that's being accused of smoking the opportunity to cure, which we mean like they can at this point enter into mediation, which is what we suggest. This neutral party that will be able to have this discussion with the housing provider and the resident, and then they can talk about the issue and try to come up with some community agreements or resident agreements that could possibly preserve their housing. And this could be anything that the housing provider, the mediator, and the resident come up with. But we want to make sure that we are offering mediation. We should meditate too, but offer mediation at this point, just for that conversation, right, before the individual is losing their housing. And then we have a fifth violation, which is where the housing provider will consult legal regarding fines and further enforcement of action or termination of lease, and it provides tobacco cessation resources. So again, I want to preface, eviction is the one outstanding topic that no one can agree upon. Of all these issues that we say, y'all love that, right? We all should meditate. But of all the issues, everyone agreed upon except for the eviction. So should eviction be a component of the protocol, or should we take that off the table? And this is all up to you. It's up to the housing provider. Again, these are voluntary policies that they can create however they want, right? And the enforcement strategy can be whatever. But I will tell you that most housing providers will create a policy with no thought whatsoever on how they're going to enforce it. So that's where you're walking into. And so you need to be the one that you say, well, this is what we suggest. Pete, if you could just, I think I just saw you eat something, but let me just ask you, because Pete has a website. His website is GASP. In section 2, Pete's going to share his website and some of his resources that he has on his website for grantees to assess. It also has a website that communicates directly with housing providers, which is great because it's kind of like that outreach that I can't provide. But Pete has 5 steps on his enforcement protocol, but they are aligned with housing provider language. So they use the language that a housing provider would speak and not necessarily this language. So it's important that you understand the housing provider's expectation legally to do this, as well as our recommendations and suggestions. Because if these don't align, the housing provider is going to say, well, this is our legal requirement, and you're not following the law. So you want to make sure that's one of the reasons why you want to know what the law is, because you want to make sure your recommendations fall within those guidelines. Pete, could you share just a minute how different the housing provider steps are from the steps that we follow in our multi-unit housing resource packet?
I'm going to pull it up on the website, so just give me a minute.
Okay. So we worked with an attorney to take our steps and overlay them on the legal expectations, and then we were able to develop these 5 steps, which encompass our language, kind of, and included their legal requirement. So if Pete, can you get that pulled up, Pete?
Yes.
Can you share your screen?
I'll try.
That's why I said, can you?
I'll paste it in. Can you hear me?
Uh-huh.
Yeah. I'll paste it into the chat too.
Okay.
Give a second here.
But there's the number one way to discredit yourself is if you go into a housing provider and you have a conversation and you ask them to do something that they know is illegal, kind of like fines, right? Because it seems like, can we fine tenants? So there are legal restrictions from applying monetary fines to residents on lease expectations. So it's important to know, like, when you make that recommendation, the housing provider will, that kind of erodes your confidence, right? They'll have doubt in you because they're like, well, no, you don't understand. We have to understand the housing provider's expectations. So Pete has copied those into the chat, and so his website is. You want to go ahead and put your link in there too, so they can visit your website. We are, like I said, going to have Pete share in session 2 his website and some of the functions on it and resources that will be available to you.
Yeah, I think that, it's more specific in terms, it's still 5 steps, but it goes into more of the requirements that are required by law, such as, most importantly is that once it gets to a point, landlords or housing providers have to provide at least a 10-day process of, to comply. And the other thing that's really important that's changed in the last 2 years is they have to, when they start the complaint process, it has to be done in person. They can't just leave a notice on the door. So that benefits us in many ways. So
that's the housing provider has to be in person, not the resident.
Yeah, exactly.
Yeah. Yeah. Every year the law changes. We subcontract an attorney that keeps us up to date on these changes. So we're able to share that information with you. And again, we don't give legal advice, but we really want to know what the legal expectation is, so we can become experts, or at least educated, educated individuals that are given recommendations that fall within the expectation of the law. Can anyone tell me what might be one of the drawbacks on a 5-step enforcement protocol? I'll let Pete say it, because Pete and I, if you have subcontractors, sometimes you agree and sometimes you don't agree. This is the one of the things that Pete and I are like, maybe not. So Pete, can you tell me what would be a drawback of 5-step enforcement protocol?
Well, I mean, of course, the longer that you delay us, the bigger the exposure to the person who is being affected by the exposure to secondhand smoke. So the longer this draws out, it creates a larger health impact on the person that is complaining about the problem. So
exactly.
I think that would be the number one problem.
Exactly. And that's why market rate housing does 3 steps. They're 1, 2, 3. The expectation is clearly outlined in their policy. They explain that when you sign your lease. But what we find a lot of times, people that have security of housing or have struggle finding housing, they're going to sign whatever you put in front of them to receive housing. I promise you. And then find out later what is expected of them. So it is important that the housing provider is clear with every new prospective tenant that they do enforce their smoke-free policy and how they enforce it. And we just want to make sure that enforcement strategy, that protocol that they're using, is an equitable one that considers housing retention and not eviction.
Yeah, and full disclosure, I did use AI to help write this, but I thought it did a really good job with some minor changes in putting together the exact steps that need to take place. If you're planning to do 5-step, and with focusing also on try to do everything you can before you try to evict people, try to get them into cessation, make every effort to try to avoid eviction if you can. But if you must evict, the way I look at it is, it used to be three strikes and you're out. That's what most housing providers will do. We're trying to get them to go with 5 or 6 strikes, and the last resort, mediation. So it's more equitable. But, the way I look at it as an advocate for the non-smoker, the non-smoker's the victim, and so they deserve to live in a smoke-free place. And so I want to help them as much as I can, as fast as I can, and sometimes that might have to lead to, okay, we've given you the opportunity. You can quit smoke, or you can use an alternative, or you can go outside to smoke, or use alternatives outside. But if you can't do that, then it's time. We need to protect the people who are being affected, and so we need to do something. So maybe we can move you somewhere else where they allow smoking, whatever. But yes, so that's my emphasis on my side.
Yeah. And we do hear that. We're like, well, I hear that from health advocates. I have a leadership advisory team, and they're some of them are like, absolutely not. 5 steps, you're just prolonging the problem. So I guess it is the way you look at it. And I will tell you that market rate housing looks at it as the faster we get rid of this individual, because they're damaging our property, they're affecting our tenants' comfort of their home. So they evict pretty rapidly. So most of the people that you might be trying to protect from getting evicted probably are living in market rate housing. But not always. This is all about moving towards something as slowly and as collaboratively as you can. So this is really about communication, education, and collaboration. And it's very hard to get. So we talk about when the protocol isn't working, right? And I'm going to ask Bianca, what percentage of the complaints that you respond to are solved?
Oh man, I'd say that's hard to say, because I feel like we never walk away saying that's fully resolved, right? So we might say, well, let's see how this moves forward. Maybe 15, that's being optimistic.
Yeah. Yes. So we're not, that's why I said this job is, it's destructive to your soul sometimes, because you're like, I just want to solve the problem. But it isn't about solving the problem for them. It's about moving toward the solution. So that one individual, you may not solve the problem for them. And using the trust model, I let them know right away, listen, this is difficult. This is long. This takes a long time. If you want out, let's work on a mutual rescission first and get you moved. And they will tell you, no, I want to stay and fight, because the next person will be exposed, right? They say this every time, but the next person will be exposed. And then you have to communicate with them that it's not about the next person, it's about you, and let's help you. So what's the best option for the good of the most people in these things? And most of the time, it is the cessation support. It is having that mediation opportunity for the individual to understand. And sometimes it's actually having a mediation opportunity with the individual that's complaining to get them to understand that there is no law and there's nothing else you can do. Because guys, you will get to a point to where you'll have to tell the individual that I have to close this account. I have to close this complaint. We have done this, this, and this, and that's all we can do. So we can only do what we can do within our locus of control. And then that locus of control really is motivating others to do the real work, which is adopting the policy and enforcing the policy equitably. So what do we do when it doesn't work? Some of the common challenges in the protocol are that residents deny smoking is occurring. Residents become harassing to community members. Housing provider seems without power to enforce. I think that was the last one. Yeah, let me go back there. Okay, so let's break these down a little bit and talk some of these out a little bit. So the resident denies the smoking is occurring. The individual says, I'm not smoking. So, like, what do, right? The landlord says, and you'll hear this a lot, we went to the unit, they said they're not smoking, whatever. So now it's up to you. Like, well, how do you prove smoking? You really can't prove smoking unless you're doing some kind of air quality testing, or I don't know, what do you all think? How do you prove smoking behind a closed door? It's very hard. I lived in a building that I was being exposed, and I used to run down the halls and think, oh, I'm going to find out who was smoking. And there's no way. The doors are closed and locked. You're not going to see smoke billowing out from under their door. It's going to come through the electric socket. You're just going to smell it. So sometimes there's very little we can do. And this would be the opportunity where you just tell the individual through the trust model, it's like, hey, the property manager says that the resident denied smoking and there's nothing else we can do. So then the resident becomes harassing to community members. Guess what? When you're told no, what happens? You get pissed. I mean, some of these people that have complained, I'll give you an example of one. I think Angie attended this education session with us, Teddy and I, and Angie went out to a housing provider. We had received several complaints and been working with this lady for a little bit of a time. And we walk into the office. It's a nice market rate. And there's the three of us. Hey, we're from the health department. We just want to talk to you about a complaint we have. And they're like, yeah, I want to talk to you about this complaint too. Come in. We sat down. She turned the screen around and started showing us video of this individual we'd been working with, cussing out people, throwing pots off of her balcony, pots of dirt on down to them. She called them derogatory names. It was horrendous. And we are there on her behalf. So we're like, oh goodness. Remember that, Angie? It was crazy. So that's why I say,
I remember.
Make sure you talk to these people in person and you get a good understanding of like, this is realistic, but you also want to make sure that you're helping that resident to remain calm because they go off, they get very mad. So it's important to keep that resident that's being exposed grounded and to prevent them from making more damage for themselves. Because more often than not, it is the individual that complains about smoking that gets evicted, not the smoker, but the individual that complains because they become harassing to the housing provider. So you want to also help that resident learn how to complain effectively. That's what we do. Help them be effective. That's it. And then when the housing provider says, there's nothing I can do, there's nothing you can do. So there's nothing you can do. That's where we start talking to that individual about perhaps we could find a place that would make you more happy. That just using the trust model and transparency, the housing provider is refused. So maybe you say to that person, if they've got the means and they've got the time and they've got the energy, like I'm happy to give you our mediator referral list, our attorney referral list, or go to one of Pete has some legal resources on his website, like free legal opportunities. Give them that resource and let them know that this is now beyond what you can help with. And then you suggest that they contact an attorney if they want to proceed. But again, in section 3, we're going to talk more about asking for reasonable accommodation. We've had some great success with reasonable accommodation, and we'll go into that later. That'll be discussed in session 3 with the attorney and the mediator, so that should be interesting. All right. So
I want to add, can I add one more thing for people too, is that if you aren't able to find a solution, do let me know if that apartment or condo is listed on our website, because they will be removed from our website and not be listed as being smoke-free if they still have not been able to fix any problems that still are occurring. So do let me know.
So what Pete's referring to is he has my smoke-free housing list on his website, smoke-free apartments, and they have he has vetted them that they have a smoke-free policy that reaches his level of smoke-free policy. And if they're on that list, or if they're advertising as smoke-free, we had one the other day. It clearly said, this is a smoke-free property. They were bragging about it. And then the manager told the resident when they complained, we're not smoke-free. So guess what? You need to change your website because that's false advertising. So with Pete, he has smoke-free properties on his website. And then Pete can send a letter to them and say, you are not in compliance with smoke-free, you're not enforce your policy, I'll have to remove you from the list. So that's something, right? But there's also, if you can go back in memory to the presentation where we talked about funding sources, there was a low income tax credit. So in CHAPA, Colorado Housing Authority and Finance, they offer these, when you get funding through them, which does come from HUD, you agree, like perhaps you say, we'll have a smoke-free policy, and then you get a 1% tax credit by having that policy. So if they're receiving a tax credit from a funder to have a smoke-free policy and they're not enforcing their smoke-free policy, then you can go to that funder and you can discuss that with them. They can send a letter and saying you are not reaching the specifications of your agreement with us because people are being exposed. So there are ways to take these real complaints up and have traction. But again, when you get to that point, like, come to me, come to Mariah, come to Pete, and we can work you through it. Because there are ways that we can go above the managers and the housing providers and have conversations. It's not always successful, but it is a path forward. Does anyone have any questions or comments, or have you been able to go through the 5 steps with a housing provider? And have you had issues? Does anybody want to comment on the 5 steps and how they feel about that? All right, hearing none. So let's not forget the most important step of your process, of our process in your report at work. Now, I'm talking about reporting because I'm going to tell you, Denver, I'm going to pick on Bianca again. So Denver had, they did a assessment of their complaints, the Clean Indoor Act complaints, and they were able to really get some great data that helps leadership understand the difficulty of the problem. So when we go to leadership and we say we need to work on an ordinance for smoke-free housing because we have an increased number of complaints, and then they're going to say, well, what kind of complaints are you getting? And I also learned from Denver going through the flavor ban what city council looks at and what they consider when they're making their decisions to enact these ordinances, approve these ordinances, or even engage in conversation about them. They want to see the data. So we have to show them our utter defeat, right? That's what we're proving. We're proving here that everything we've tried has not worked. So if we have a 15% success rate, that's not very good. We need support. And most of the reason for the failed success is the inability to have policy to point to say, no, this is what you must do, because housing providers, because it's a voluntary policy, are really leading the charge here. So when you're reporting, you want to make sure you document your activities. So you determine how to track your secondhand smoke complaints internally. If you look at the guidance document, you will see on the very beginning, it says, use the recommended step reporting system or create your own system. So Raya and I and Teddy work together to create a reporting system that you can use. It's already there. Raya can give you the link and you can do that. Or you can create your own reporting system, but it's really important that you track these complaints as you respond to them, because you need to show what you've done, as well as keep track of what you've done and discover, how are we improving? How can we evaluate this? How can we improve our housing work? And then it's important to report your work, because if you don't put this in your quarterly reports, no one ever finds out. Your PO may know about it, but it doesn't get shared at the level that we like it to. So we really want to make sure you're reporting that in your quarterly reports, because you need to get credit for this work. And as a state, we need to develop protocols and find out a way to expand that. Let's see. Yeah. Thank you, Ryan. And then obtain support. So if you get to, I don't even care if you got your first complaint and it's simple and you don't know where to start. I don't care. Call me. I'll sit down with you and we'll go through it. So there's no level of support that's too much for me. Either you're a novice beginner or you're out there talking about, like Jennifer said, let's talk about an ordinance. Hey, let's go with that too. So we can support you on all levels of this, whatever you're determined to do. And I'll tell you, the main reason for these trainings, and everyone's like, well, 15% success rate, that's awful. It is awful. But we have to do something about it. So the reason I'm here and I keep training on these things is I want you to know, if you're a novice, I want you to know the beginning, because that's your expectation to respond to these complaints. What I'm really hoping is that you'll get engaged by this work, that you'll find out people are suffering in housing. And housing is one of Maslow's hierarchy of needs. It's the base. Housing and security is the base of that. So we need to be supporting our residents that are living in shared housing. We have to have solutions for them. So if you're not doing 2.1, if you're not doing that work, I want you to consider, we have a new opportunity in the following year to select new strategies. Take this year to look at your housing and see, like, what could we be doing to help? It doesn't have to be big, but what could we be doing? Cessation? Could we be doing outreach, walking into housing providers with swag and saying, hey, how you guys doing? What do you need? And moving into the tobacco policy conversation once you build that trust with the housing provider. But I want you to see housing as a gap of care. And I want you to see that there are possible activities we can engage in to help them, if not move them forward a little bit, but at the very minimum, to educate them that housing is not protected in the Clean Indoor Act. Housing is not protected anywhere. These are all voluntary policies outside of HUD. So that's what I want you to do. Rooms, and let's start with 4. 2, 3, 4 here. Okay. So who was the scribe for 4? Everybody in 4, turn your cameras on and join us if you want so we can have a discussion. This was the really fun one. So who is the spokesperson for group 4?
We definitely forgot to assign one.
I guess it makes you.
Yeah, I'll talk in my group. If you can, if I've left out anything, feel free to add on to it. But basically, this one was very challenging because, I mean, the smoking was occurring in the apartment, so therefore it's not a CCIAA violation, but they are in violation of their smoke-free policy. The only difference is we don't really know. I mean, Sarah did some research about what their policy said, but we don't I didn't really know any specifics about what their policy said, and so I was thinking along the lines that if I did follow up with this constituent, I would ask them I received your complaint, and I noticed that in the details it said that you had gotten you had contacted the property manager, and then I was going to ask if their property manager had gotten back to them yet, and if they did what they said. Other than that, I really am not sure how to approach this specifically. But
yeah, it's a hard one, and that's why I put it on here, because some of them are like, oh, we don't do that. Okay, so you may not do this, but you still have to have a response, right? You just because I don't do that, I'm not even going to respond. So you have to talk to them, and there's a lot to be learned here, right? So first of all, it's a roommate situation. So it's like a house or condo that has a stranger living in the next room that you have not invited to live there, but somehow a property manager has rented out these rooms. It happens a lot. This happened in Boulder. That's why I shared this, because it does. This is now happened again. So property managers sometimes will rent out rooms in a shared house of 3. And so the person that moves in is a stranger to you. So Nikita's right. The first thing you do is have you talk to the property manager, the person that put the individual in there. Of course, you want to have a conversation first. Now, the issue in Boulder was a very much a language barrier, and also from different geographical locations, they had different values. And this person isn't uncomfortable talking to the person in the next room about their exposure, right? So you have to get in there, and that's when you really look, and when you're looking at your reflection and how to respond, is what's the best good for this individual? So this would be something that I would definitely reach out to a TA about, because I'd be like, well, I don't even know how to start. I mean, you can always have a conversation without reaching out to TA, which would give you a little bit more detail. So when you come to me, you would have more detail. So don't be afraid to pick up the phone and call these folks, right? They put their phone number in these complaints. So if there's anything unclear, you don't know, just call them. Don't use your own phone. Use a private number. Use your work number. Don't ever give your home phone number to any individual that complains. But to highlight here, it says type of concern or complaint, Clean Indoor Act violation. So our number one goal here is to educate this individual that this is not a clean indoor act. Because if that's all we can do, that's all we can do. But that's the motivation, right? Well, it isn't it's not protected, but in the Clean Indoor Act, because they all put this in as a Clean Indoor Act violation. It actually is a multi-unit housing or a housing violation. So does anyone from group 4 want to give any more about confusion or thought about this complaint? Devin says no. Good to see you, Devin. Okay, let's go to room 3 then. Breakout room 3. Who was in breakout room 3?
Was me and Pete, which was convenient because I'm in El Paso County, so this was a complaint I received.
Yay! See, I told you might get yours fixed while you're here.
Indeed. So I think a challenge inherently when you look at the complaint is that they're mentioning a condo. I find like HOA properties to be even trickier than apartment complexes. With this particular complainant, we discussed, right, like the need to look into what like the HOA's rules were and if there was anything that would allow them recourse for this issue, and it was the owner complaining. With this particular person, they kind of wanted to proceed forward on their own talking to the HOA, which I think highlights, right, that importance of like talking with a complainant first. But I think in general, like HOAs just feel really tricky because the ones I've encountered like have not had anything that even makes like outdoor areas smoke free, and the ones I've encountered like have required that whole like vote from all owners to like even begin a process. And I think when people hear that that's what they have ahead of them, they're just like, okay, I will deal with this. And if it's a renter, like we can talk about trying to work with you know, your landlord to see if you can leave or things like that. But if it's an owner, it's just a very difficult place.
Wish I could have been in that breakout room with you and Pete. That would be great. So Veronica, I've worked with you on several complaints, and that is perfect. It's wonderful. So the number one thing she's saying, she had talked to the person. It helped her figure it out, right? Just talking to the person. But there's one thing very important in an HOA situation that you want to know. Are you a renter? Are you an owner? Because your response is going to vary based on that information alone. Now, HOAs are so complicated and extensive that we've broken this out. Our last learning community call, which is May 14th, I'm going to be sending out an invitation. Teddy from Denver Department of Public Health and Environment is going to be covering HOAs in depth. I looked at his presentation yesterday and it's really good. So it'll give you more information on HOAs and what all is involved in having an HOA adopt a policy, because you can't just move someone. They own the unit. So you can't evict someone because they own the unit. So there's a lot of details in there. So when you see that learning community call come up next week, please plan on attending, because that'll be the information that we offer on HOAs. Okay.
Yeah.
So
I stressed a little bit to make sure to review the covenants and the bylaws, because there are some condos where the board does have the authority to enact policy. Not many, but there are a few, and I've had some success with that in the past. So, and then I also mentioned that, and we have this. I'm sure Teddy will talk more about it as well, but there was a case in Colorado many years ago in Jefferson County. It's on our website, where a condominium made a smoke-free policy and a smoker sued. She lost because the covenant had some language in it about the peaceful enjoyment of the property and any noxious nuisances. And so the judge felt that preceded her right to smoke. And so she lost that case, and they became smoke-free. Unfortunately, it was just a four unit condo, small one, but still it was a precedent that was made many years ago.
Yeah, there's a property up in Grant, I think it's Grant County, Silver Creek. It's called Silver Creek. It's a big hotel, Airbnb, and owners. And Casey Rose, who's up in that area, who's a nurse, she got the complaint. We've had several complaints across the years from Silver Creek and never been able to do, because they're a hotel. Their hotel portion is smoke free by law, Colorado Clean Indoor Act, because it's a hotel. But then they have the Airbnb portions, which are kind of like HOA run, and then the owners, which are also HOA. Thank you, Bianca. That are not smoke free. So how do we align those? So she is actually, through one conversation, she was able to get the smoker to join in cessation opportunity. So he's quit. And he said to her, when she asked him, how would you like to take an opportunity of cessation resources? He said, hey, I just had a stroke. I'd love a reason to quit. It doesn't always happen like that, but sometimes it does. And then the HOA said, hey, we're looking to align our policies. So yeah, let's work together. So it does work. It's not always easy, but there are things you can do and recommendations you can make moving forward. Now, group 2, do you want to, your scribe want to pop on and go over your complaint? Looks like at Harvest Building 40.
So, we didn't really have a scribe either, but this is a case I've been working on this last couple weeks. So this is good. Perfect. So it's not a Clean Indoor Air Act violation. It is a apartment complex. They have no kind of smoking policy there. I did speak with the person who made the complaint, and I mean, she understood too. I mean, because they make it very clear when you move in that this is a smoking property. She just wasn't sure if there was anything else that could be done, because the newer neighbor that moved in, it's just constantly getting into her place. She can't open up her windows or anything. So she knew kind of going into this that, there might not be a lot of answers, but I did speak with the property manager, and the property manager explained too. I mean, it's an almost 40-year-old complex, and they have a lot of people that have been there for a very long time. They are not planning on establishing any kind of no smoking policy anytime soon. Which and like she said that they make sure that they tell their, people there when they are signing their leases. She did, however, offer to waive any kind of transfer fee if she wanted to move into a different unit. But like I explained to the person who made the complaint too, you could move to a different unit. It could be 3 weeks of awesome neighbors. You have, no one's smoking, no one's doing whatever. And then someone moves out, someone else moves in, and they start smoking as well. So it's just, it can get very difficult, but, so yeah, so it was really, just kind of explain to her, what her options were with that, which she was fine with. But I will say the opportunity part was really cool, because the property manager did say, if we ever have materials, even our cessation, our quick kits that we have, if we ever want to have presentations, education, set up a table there in their lobby just to educate their residents, we are welcome to do that. So I'm working with the property manager now to try to set up some times and days to see when would be best for our team to go out there and just see what information people need, including for other areas that we work with as well.
That's great. See, now you can go out, you can peer-to-peer mentor. Ashley can help you. So every complaint that you answer builds your knowledge, and it gives you more for next time. So we want you guys to be sharing that with each other, sharing that with Seth, sharing that, but also understand that, like when Casey had to do that work with Silver Creek, she had to do an amendment on her budget to transfer money over to give her the capacity to do that work as an emerging issue. So this is why I want you guys to consider adopting housing as a selection in your IP plans. Housing needs some work. So if you can budget and fund some of this work, just like Ashley says, the cessation opportunities, the engagement opportunities, helping them with their policy, it's all capacity building work, but it also is capacity draining. So make sure that you have a team that can respond to these. And the best way to do that really is to just write it into your work. So another plug for next year's funding. And then session one, we're not gonna, we'll pick up that in our next session. I want to make sure we answer any final lingering questions. And again, plug session 2. We're just going to kind of pick up where we left. We'll do more of these breakout rooms, a little more. By then, you will have the HOA training from Teddy on the Learning Community Call, which will help support your understanding of that area. And then session 3, I want to just highlight that it is scheduled for May 7th, but we are needing to change that date to May 21st. I didn't want to overload you guys with emails, so I'm going to be sending out that date change to you, and hopefully the 21st works as well. And in that third session, guys, it's going to be kind of high level. It's an attorney and mediators talking about what they do to solve housing solutions. And we'll also do a little breakout rooms with them to talk about how can we talk to housing providers about obtaining mediation, and how do we find mediation that is affordable or at no cost to our housing providers. So with that, I'm going to say one, I just want to, no, I'm not going to plug it. Anyway, I had one on permanent supportive housing. I'll put that in session 2 for you. That's where we'll start. Does anyone have any questions, concerns, or any plugs for what they might want to hear in session 2 that they didn't hear today before we break for the day? Any comments? All right. That being said, go enjoy your day today. I appreciate you guys, and I'll see you the next time. If you have any questions, just email me. All right. Thanks, guys.